The study that I performed in conjunction with my collaborators was to look at the largest set of ovarian cancer tumor specimens, over 4,100 ovarian cancers, peritoneal tumors, and fallopian tube tumors, and look at the different molecular changes that occur within these specimens to try to identify the individual characteristics of subsets of these tumors to help us better group them into therapeutically relevant, targetable populations. And the way we do this is we use comprehensive genomic profiling. This is a hybrid capture-based next-generation sequencing platform where we look at 315 different oncogenes and other cancer-related genes, fully sequence them, and we're able to capture all 4 categories of genomic alteration. So mutations, insertion, deletion events, copy number changes, which are both losses and gains, as well as rearrangements. This is incredibly important to this study because this depth and comprehensiveness of the sequencing approach is required for the next level of observations that we're able to make. So the first level is identifying mutations in any one of these over 300 genes, but then the second level is to get almost like a global genomic-wide landscape of how well the cell's double-strand break repair process works. So their homologous recombination pathway. We know that in ovarian cancer, a large proportion of these tumors have loss of the ability to repair this kind of breaks in their DNA. And gynecologic oncologists have been taking advantage of this Achilles heel, but didn't know why it was working for a long time. So platinum-based chemotherapies actually introduce additional double-strand breaks, and it's for this reason that it's believed that, partially that these chemotherapies are so effective in many of the ovarian cancer patients. So one of the great things about our technology is that we're able to observe a signature called loss of heterozygosity. This is when a cell loses its ability to use homologous recombination, which is the high fidelity repair pathway for double-stranded breaks. It has to go through like a collateral channel that is a much lower fidelity way of correcting these errors. And as this pathway is used over and over again in the tumor cell, a certain very specific type of mutational pattern accumulates that we can observe in our sequencing. And we can not only just observe this, but we can quantitate the amount of the genome that is experiencing this type of loss of heterozygosity effect. And in the Ariel 2 and Ariel 3 trials with the PARP inhibitor rucaparib, it's been shown that patients that have homologous recombination deficiency respond to the synthetic lethality of the PARP inhibitors because they block the collateral circulation through other repair pathways. So we both have a way to identify patients with this biomarker and also have some clinical data to show that this is an important way of stratifying patients.